spouse, Dr. Donald Abrams, who is Chief of Oncology at San Francisco General and works at the Osher Center for Integrative Healing. And Donald, when I met Donald back in '94, he was fighting the National Institute on Drug Abuse to try and do research on HIV/AIDS patients with inhaled marijuana, because there were so many great reports of how people were benefiting from it. And the National Institute on Drug Abuse would not allow him to have the marijuana to do the research, even though it had been approved by the Research Approval Board for the University of California, San Francisco. It had been approved by CRAP, the California Research Advisory Panel, which after he kept talking about them, changed their name to the Research Advisory Panel of California. All of these agencies had approved the research, but the National Institute of Drug Abuse would not provide marijuana for the study. So that, you know, they don't, the National Institute on Drug Abuse, Donald learned, their congressional mandate is to provide funding and material for research that is intended to do harm, to find harm. They're not really allowed to provide marijuana beneficial research. So he kept fighting. They rejected the first study. They rejected the second study. And then they told him he needed to try and pitch it as a harm assessment study. So he did a Trojan horse, created a study that was intended to show harm but had secondary values that would reveal benefits. So what he found out was that people who used Marinol and marijuana, inhaled marijuana, who had HIV, had a significant amount of weight gain compared to people who did not. But interestingly enough, it didn't stop there. The cannabinoid group, HIV group, had better immune function. Their immune systems improved in their levels of activity compared to the people who did not use cannabis. And we've seen that in some other studies. There was one in, I believe it was baboons with simian AIDS, essentially. And it showed that THC, cannabinoids, block the ability of the HIV virus to actually infect cells. It provides something of a shield and reduces the viral load. So they're trying to get a video up. So Donald kept doing studies, or trying to do studies. He's done a study with inhaled marijuana through a vaporizer, the volcano, and he found that, in fact, you don't get the harmful gases and matter when you use a vaporizer as you do when you smoke, but you do get a really good delivery of cannabinoids into the bloodstream. And with the vaporization, for some reason, it lasts a little bit longer. The level holds a little longer in the bloodstream than with smoking. So he's also done research with pain and opiates, and found that using cannabis in conjunction with opiate pain relievers can it potentiates the effect of the opiate so that you can reduce the amount of opiates taken. And that's always a good thing, because we know opiates are far more harmful than cannabis. Now, you got them? Sickle cell is a disease of African Americans, and it causes pain and other degenerative illnesses. And he wants to do research with cannabis oil. So hopefully, and cancer. So hopefully we'll be able to see some of that research done soon. Next up, we have B.E. Smith from Wheat Country. B.E. is from Trinity County, part of the Emerald Triangle, one of the greatest places on earth for cannabis. And that's one thing I just don't understand. They grow all this cannabis in a greenhouse for Sativex, GW Pharmaceuticals over in Britain.
What the hell are you growing cannabis in Britain for? Come to California. California is where we grow cannabis, the best in the world. The most medicinal, the best tasting, the most exquisite cannabis on earth is grown in California. We should be as proud of that as we are of growing some really top-notch wine grapes. So, B's from Trinity County, and he's a Vietnam veteran, and he's been using cannabis for PTSD, and we really need to make a stand for that because there are a lot of veterans who are suffering, who have come back from the Iraq and Afghanistan and have had head injuries and all sorts of ailments that come from their service, and we need to stand with them and make sure that they have access to cannabis. And he's going to talk to us about our liberties, about what we can do to ensure that we have the right to grow and use cannabis, and how we're going to dial back all these restrictions that short-sighted, ignorant politicians are putting upon us. Come on, B, and tell us about it.